Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome back to the Financial Survival Network. It's Kerry, Lutz, and lots going on, but more importantly, what's going to happen with Obamacare? You've all probably heard by now. The truth has come out by one of the prime architects, Jon Gruber, a brilliant economist from MIT. They only have brilliant economists there. We've got Craig Lack back with us. Probably heard him back on here before. He's coming up with performance-based health plans to help companies, individuals really eliminate the need for healthcare by staying healthy. And I wasn't aware of it, but he actually received an XB award in recognition for his many talks about the Affordable Health Care Act and how to translate, interpret, and ethically exploit the ACA. And Craig, welcome back.
Hey, it's great to be here, Kerry. Good talking to you.
Yeah, you too. So look, you got this guy, Jon Gruber, more or less just confirming what we all knew. He said pretty much that they were, to summarize it, that they were relying upon the stupidity of the American voter to get this whole thing through. I don't know if it was so much the stupidity as the willingness or the, I'm always reminded by, what was that, Streetcar Named Desire, Blanche Dubois, the willingness to rely on the kindness of strangers. And I think the willingness to rely on the kindness of the government. I mean, that's people just buy into this, and that's what they want, right?
Yeah, I think, generally speaking, most people, regardless of their political leanings, they want to believe in whatever facilitates what they already believe. And so if you already tend to believe, I think if we looked up the definition in the dictionary, we'd probably gullible was a better word to use than stupidity, right? And so people were gullible to believe because that facilitated their belief in the political system that the government was actually there to help them.
Yeah, that you can get something for nothing. And I think it was one of the founding fathers, I want to say Jefferson, but I could be wrong. The problem is always that 50% of the people want to live at the, off of the other 50%, right? That's what it comes down to.
Yeah. I think it's that old saying, if you rob Peter to pay Paul, you can always count on the vote of Paul. Yeah.
So, maybe he wasn't that artful in what he said, but there's really nothing new under the sun, right?
Yeah, it shouldn't be a complete surprise to people that it's possible for people in political power to be deceiving to the American citizens.
Yeah. But, being that it's politics and there's always the people who are in power and the people who are out of power, the Republicans are going to exploit this to some end. And this thing's got to be fixed. It's not working well. It's costing way too much, and it's neither affordable or, it's not helping. So something's got to be done with it. They're going to have to fix it, right?
Yeah, but of course, depending on your personal interest level, what do you mean by fix? Right? In the immortal words of our former president, it all depends on what the definition of fix is.
Well, fix could be, it could mean sterilize like you do to your house pets, or it could mean to actually come up with a solution to problems involved with it. We also have, the Supreme Court decision hanging over this, which could well mean that the subsidies, which are crucial to the whole functioning of Obamacare, could be wiped out in, I guess, 30 some odd states, which would really
that would require a fix,
lot of problems. Yeah. I mean, what's Obama going to do then if there's no subsidies? Because that thing is definitely not going to work, right?
Well, think about how they've aligned the incentives now. So you just work through the scenario. So if the Supreme Court says, hey, you wrote the law, and based on the way you wrote it, it doesn't work. You can't do it the way you did it. So okay, so now pretend, so of course the White House is going to be interested in the fix. The Republicans are going to be looking for an opportunity to shine. The Democrats are going to try and demonize the whole thing and say, well, you can't take away people's insurance. You know, they can't wait for the next election fast enough to run on that platform. Mm-hmm. And then now you got the insurance company saying, oh, wait a minute now. We just added several million people after only 1 year. They'll probably double here this next year. You know, they want that revenue coming in. Mm-hmm. So, you know, so even if there's a new requirement to have a fix, my suspicion is that the power is aligned so that there will be a fix for that. Mm-hmm. I don't think you're going to see that as, you know, the crumbling of the law. I think you'll just see the facilitation of new fixes and the opportunities for more change. Because, you know, we've had over 40 changes to the law already, and there will continue to be changes.
So it's here to stay.
I believe it is, because if you just think about some of the core features, hey, we want kids to be able to stay on their parents' insurance until 26. Everybody loves the idea of guaranteed issue now. No more pre-existing conditions. You know, can you imagine being a politician saying, no, let's bring back pre-existing conditions so we can be the party of no?
Yeah, it's not going to happen.
and not let people get insurance and not have a solution for them.
So what if we just leave those two things? All right, those are the two primary benefits, the way I see it. Mm-hmm. Everything else in this thing is garbage, okay? It just makes things a whole lot worse. You leave those two things, get rid of the rest, and let them fight it out. Is that doable?
Well, just about anything is doable. I don't think you're going to be able to paint it with that broad of a brushstroke. Mm-hmm. There will be, because we're going to remember the Affordable Care Act changes everything in healthcare. Mm-hmm. So to say that we'll just keep these two things and leave the other 18,000, to be fixed, I don't think so. What's going to happen is, depending upon who's lobbying for which parts of it, the deepest pockets will get paid attention to the most.
Yeah. Funny how that works, especially in healthcare. Well, especially in anything, let's face it. This is America, right?
It's the way our political system has been set up. Mm-hmm. And so, it becomes a challenge to have things that are going to really benefit the masses when we have such a short list in the power structure to be able to facilitate what they want first.
Yeah. So, but who are the real winners under Obamacare? Craig, I mean, you've studied this thing. Who really wins?
Yeah.
Insurance companies and hospitals?
That's a really good question. And so I'll use my analogy to checkers and chess. So to me, to the inexperienced, you're going to think that the insurance companies are winning right now. And I would tell you that that's playing checkers. Right? You can't. Grandmaster chess champions say they play 12 to 15 moves ahead of time. Right? Mm-hmm. Checkers doesn't afford that many moves ahead of time. So it's much shorter term. So yes, in the short term, insurance carriers have a 3-year backstop the way the law is written currently. But after that, they're on their own. And then the law was written in such a way to put the highest, most risky people possible to sign up on the program as opposed to the healthy people, despite all the flapping and marketing that they're going to get the healthy people. They knew they wouldn't. And so in the long term, the chess side of it says, years 5 through 8 is when the real drama is going to begin to determine. We're then going to see, will carriers be in what's proverbially called the death spiral, where they can't generate enough new premium revenue to pay for all the bad claims that they were forced to absorb as a result of this law. And so that will be, the tightrope that we see over time. And then, that's the commercial side of it. Then we have, of course, the Medicare population. 10,000 people turn 65 every day for the next 14 years. And people over 65 tend to consume the most health care. And because our system pays the supply chain, hospitals and doctors, based on the volume of treatments, you can start to see that there's going to be no end to the medical inflation that we've become accustomed to over the last 2 decades. And there was going to have to be, at its core, changes that that don't facilitate insurance reform so much as the Affordable Care Act does, but in fact changes to the basis of what is health insurance supposed to do, and how can we instill personal responsibility in the public at large to be responsible for taking care of themselves, because most of the claims are preventable in the first place.
And that's the hardcore reality that most of you out there don't want to face, and that the law itself never, ever really addressed. And not to mention the epidemic of frivolous lawsuits. And I can say that being an attorney. Hey, when we come back, let's talk about that and things that you can do to minimize your need and your demand for medical services on the Financial Survival Network.
FSN Radio. It's all about what's next.
Worried about the coming dollar collapse? Then you need to speak to Tom Cloud today about buying gold and silver. It's the key to protecting your wealth from a declining dollar. Call him now at 800-247-2812. Tom will help you find the exact right bullion products to keep you safe. Would you believe that Tom's been in the business for 38 years? Tom understands these markets better than just about anybody. He's seen bull markets and he's seen bear markets, and he's not worried, and you shouldn't be either. When it comes to uncertain times like these, there's only one place to turn, and that's gold and silver. And Tom's offering all FSN listeners free shipping and insurance. So call Tom now at 800-247-2812. That's 800-247-2812, or visit cloudhardassets.com and tell him Kerry sent you.
The Financial Survival Network. It's all about what's next.
Hey, in case you just joined us, got medical authority Craig Lack with us. We're talking about Obamacare and healthcare and health, because that's where it all starts. And Craig, so right, individual ultimately is responsible for your health, right? Your health, it all starts with your lifestyle, exercise, smoking, drinking, engaging in unhealthy and harmful habits that really, it feels good when you do it for 20 years, but then, after you've been doing it a long time, eventually it catches up with you, right? And then you got problems, and then you expect the government, which is us, the people, to pay for it all, right? Isn't that what it comes down to?
That is, that's the biggest component of it long term for the safety and security of everybody, is the fact that, we are really in control of our own destiny, and we are more responsible than anyone else for the long-term effects of, the demand side of healthcare. Mm-hmm. The supply chain is what it is, and it only needs to change slightly. It's the demand side that is the problem in this country, and so that's what we need to be prepared to look at and change, because demand is driving pricing.
Yeah. So I'll give you a for instance personal one. My brother is like morbidly obese, and his hips go bad, and but hey, we're a civilized, compassionate society. Do we just tell him to go get a wheelchair, or do we pay for his hip replacements? That's what it comes down to. And you listen to the progressives, and of course we have to pay for his hip replacements, even though he could have lost the weight 30 years ago and he'd be walking around doing cartwheels now. And even the so-called conservatives say, well, we have to pay for it. But is that really fair to require you and me and the rest of us who lived healthy lifestyles to have to pay for those who don't?
Mm-hmm. Well, it becomes a bigger challenge in a society that has been changed over decades to believe that there is very little personal responsibility, and that you're a victim, and that it's somebody else's fault, and that you really shouldn't be accountable for things, and to blame genetics on all of their health issues as if they couldn't influence it, or to blame the environment. It wasn't me. It was that fast food chain who forced me to supersize. And, we just see example after example of how the values in America influence, everything in society. And so healthcare is really a symptom of, a greater change in America probably than really being a cause.
Yeah, well, but somebody's got to take responsibility for some condition. Now, granted, you walk across the street, you get hit by a speeding car, drunk driver. That's one thing, but at some point, that's just...
The auto analogy is really good because sometimes it's easier for people to understand one thing by hearing it related to something else, So if auto insurance were like health insurance, then your insurance policy for your auto would literally, as a result of the Affordable Care Act, no one would have insurance and you could drive around. And literally the auto insurance industry would have been told, anybody with a totaled car can now come to you and you have to pay for that.
Yeah.
So that's what eliminating pre-existing conditions did. It said there's no more the concept of how insurance works was eliminated. And insurance companies were mandated, you must take everybody, any single individual that has a totaled car, you have to pay for now. Okay, so that's a big deal. And if health insurance worked, or if auto insurance worked like healthcare, getting, the ding in your windshield from driving on the freeway behind the truck, that would be covered by insurance, or getting your car cleaned, getting your car washed would be covered, and changing your tires would be covered by it. And the list goes on. And it's like, well, no, nobody would ever pay for that for auto insurance. Okay, then. So why and how did we redefine healthcare from the 1960s, 70s, and even to the mid 80s as an emergency backstop in the event of a catastrophic illness into, well, a really great health plan pays for everything, lets me get whatever I want, whenever I want, from whoever I want, and a third party pays for it all.
Yeah.
See, we completely redefined what health insurance was designed to be over the last 30 years, and yet we clearly see the differences in other insurance. So it's a challenge we have to overcome.
It's not really insurance, because insurance is providing you protection against an unforeseeable occurrence. And the fact is, you smoke cigarettes for 30 years and get COPD or lung cancer. That is not unforeseeable, Craig, that's very foreseeable.
It's true, but we live in a society where people do not feel compelled to practice delayed gratification.
Yeah.
It's like, man, that cheeseburger, the double cheeseburger, chili fries, and the soda, they're just too good, followed by a shake, right? And it's like, well, God, if we had some way to say that's worth 7 days of your life, is the meal that good? Right?
Yeah.
We don't really have a way to connect the future cost of that, so people just go for all the pleasure they can right now.
Mm-hmm. Yeah. And
yeah.
Just take a look, go walk through a mall now, and you see the results, right?
Right. I mean, they just had a news story last week, 49 states out of 50, 70% overweight and 30% obesity.
So,
gosh, guys, that we weren't born that way. It didn't happen several generations ago. Look at westernized countries and how their weight changes vary dramatically around the world once they get westernized, and you start to see, there is a cause and effect.
Yeah, and
it's related to what you put in your mouth has an impact on your body today, tomorrow, next year, next decade.
Mm-hmm. Look at the diabetes epidemic in China, no less. It's huge. It's just unbelievable. And why not charge people for their health insurance based upon the deviation from their ideal weight? Is there anything wrong with that?
Well, funny you should mention, in the Affordable Care Act, there's quite a bit of time and space designated to outcomes-based wellness programs, with the idea that There are national norms for cholesterol levels and blood glucose levels and a BMI index, and there are obvious differences between smokers and non-smokers. And your ability to measure that as a corporation through a third party who protects the protected health information, you can then assign different charges to your workforce. Think of it as good driver discounts. We fully expect that a myriad of 20 different discounts for auto insurance, but in healthcare, everyone pays the same. Well, yeah, I know that's how they've always done it, but it doesn't work. Mm-hmm. So what's been available in a law called the HIPAA law, 7 years now, over 7 years, we could charge different employees different premiums. And now with the Affordable Care Act, those premium differences can be as much as 30% or 50%. And the differences in what an employer is charging its workforce based on an outcomes-based wellness program or smoker, non-smoker charges. Right. So there is the ability to do these things now. It's still a little bit controversial at some employers because they take it to extremes. All right. Yeah. Like anything, there's always somebody who goes, well, let's push the limit and see how far we can make this. Yeah.
Yeah. Well, I took a driver improvement course. I have Geico, and I think I'm saving about $130 a year on my insurance.
Yeah, they put that little device under your dash, and it monitors your driving.
I don't want that.
Every time you drive, and that's another level of discount.
No, I'm not going to get that, but I did take the course.
So think about that. Now, in some states, they have insurance for auto insurance that says, hey, it's silly that because you're this age, you drive this value car, and you live in this zip code, we're going to charge you, basically, we're going to overcharge you massive amounts of money. Because you only drive 600 miles a year. You're a little old lady, right? So now there are some states where you can pay your auto insurance based on how many miles you drive.
Right.
That's brilliant.
Yeah.
Right? Yep. So just use that comparison metaphorically and say, gosh, what if we had healthcare like that?
Yeah.
Well, you know what? We do. We can design healthcare so that you get all the good driver discounts that you're entitled to. So in fact, you can have a lower deductible or richer benefits than somebody who goes, hey, I'm not doing anything. I'm not changing anything. I like mayonnaise and potato chips, and I like my Dunlap syndrome.
Dunlap syndrome.
Great. Then you're going to pay more for your insurance. It's totally fair. We already do it for life insurance. We do it for auto insurance. We do it for homeowners insurance, and we need to do it for healthcare.
More than ever, because and there should be, standard deviations and really substantial discounts, like the guy who jogs 10 miles a day and, has a BMI of, like 24 or whatever, should really get the discount. And, And we should have real numbers, because we could have a whole conversation just about BMI and how that was hijacked and it was never intended for what it's used for. Right.
But that's a different story. Let's just how about the analogy of a gas station? The vast majority of Americans drive. We love being able to drive, and we have freeways everywhere. Yep. The gas station's nothing more than a toll tax.
Sure.
And those who drive more pay more in taxes.
Yeah, exactly.
We're used to it. We just don't think of it in terms of what it actually is.
Right.
It's a taxing toll station for the privilege of being able to drive on the roads. Hey, why not have healthcare work the same way? I don't consume healthcare. I shouldn't have to pay very much.
Yep.
Right? Well, hey, if you use the Affordable Care Act as a competitive advantage and you know how to ethically exploit it, you can do it all day long. And all the major corporations in America have been doing it for years.
Like with an HSA, right?
That's one strategy.
Mm-hmm.
Yeah. Why? Think about this. The latest data that came out, 1% of a workforce incurs 23% of the claims. 10% of the employees incur 66% of the claims. 25% of the employees incur 87% of the claims.
Wow.
That means 25% incur 87% of the claims. So most employers massively overinsure 75% of the employees, so 25% can accrue all the benefits. And if you do that on a prepaid basis, fully insured, as opposed to being self-funded as an employer, then all the good health claims experience of your workforce goes to the insurance carrier's bottom line instead of yours.
Down the drain. And on that note, we got to run. Hey, Craig, just tell us websites where we find you.
You can find me at CraigLack.com or PremiumReductionStrategies.com.
All right. And we'll have those links, as always, in the show notes to this interview on FinancialSurvivalNetwork.com. Make sure you sign up for our free newsletter. Craig, as always, a pleasure. Thanks so much for being on.
Great talking to you, Kerry.
FSN Radio. It's all about what's next.
Every week, the show is growing. Would you like to be a part of it? Then go to clubfsn.com and help support us with $1, $2, $5, or $10 a month and get a host of premium content with newsletters dropped into your mailbox, free books, private audio clips, webinars, and much more. Then join clubfsn.com. If you want to get ahead of the trend and ensure your family's financial security before it's too late, go to clubfsn.com and sign up.
FSN Radio. It's all about what's next. Go to FinancialSurvivalNetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.